Skin reactions such as redness, dryness, and just irritation of the skin can occur. And then since we're radiating the lung, we can also cause a cough, and that's due to the inflammation from the radiation. Patients can also get esophagitis if the tumor that we're treating is close to the midline of the chest near the esophagus. And probably the most common side effect that we see is fatigue.
You're listening to the ONS podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from bench to bedside and everywhere in between. Hello and welcome to the ONS podcast. I'm your host, Jaime Weimer, Manager of Oncology Nursing Practice at ONS. And today we're talking with Amy MacRostie, Radiation Oncology Nurse at St. Charles Cancer Center in Bend, Oregon, about radiation side effects in lung cancer. This episode provides free NCPD contact hours. To receive credit, please review the episode notes for any guest disclosures before listening. Following the episode, complete the evaluation we've linked in the episode notes. Welcome. Thanks so much for joining us today, Amy.
Thank you for having me. It's an honor to be here.
All right, well, let's get to it. Let's start off with just talking about the types of radiation therapy that can be used to treat lung cancer and what determines which type is used.
I think it's important to start with the types of lung cancer. And there's two types of lung cancer, non-small cell and small cell. And then depending on the type of cancer, location, and stage, that will determine what radiation technique will be used. The types of radiation that can be used are external beam radiation and stereotactic body radiation treatment, or SBRT. External beam radiation is often used in combination with other treatment modalities like chemotherapy, immunotherapy, and targeted therapy to treat these cancers. And SBRT is usually done solo, and it's a highly precise treatment for inoperable or early stage lung cancers.
So how commonly is radiation therapy used as part of the treatment plan for lung cancer?
Well, radiation is one of the most widely used treatments for both small cell and non-small cell lung cancers. And depending on the goals of care, the treatment can be definitive or adjuvant, which would be after surgery, or palliative in nature for symptom management, such as pain control.
Let's talk a little bit about some of the more common acute side effects that we might see or be watching for our patients who are receiving radiation for their lung cancer treatment.
Skin reactions such as redness, dryness, and just irritation of the skin can occur. Moisturizing with unscented lotions can help calm that skin reaction. And then since we're radiating the lung, we can also cause a cough, and that's due to the inflammation from the radiation. Patients can use over-the-counter lozenges if the cough is bothersome, or providers can even prescribe cough medicine, or Tessalon pearls work really well. Patients can also get esophagitis if the tumor that we're treating is close to the midline of the chest near the esophagus.
If the esophagitis is painful to where the patients are struggling to get in good nutrition, providers can prescribe medications to try to decrease these symptoms. Every practice is different, and what is prescribed can be based on provider preference and not necessarily with firm evidence for efficacy. But in our practice, providers will prescribe special mouthwash, or I even heard it called magic mouthwash, which is a mix of lidocaine, Benadryl, and Mylanta. And I'm not sure it's magic, but it can help soothe the esophagus.
Patients may have hair loss in the treatment field there on their chest, but that hair usually does grow back. And probably the most common side effect that we see is fatigue. And it's just important that patients stay active and do what they can to help counterbalance that fatigue, but then also listen to their bodies and rest when they need to.
And we also know that, of course, side effects from radiation treatment, while can be acute as the ones you've just described, we can also see late chronic side effects occur after treatment has ended. So what are some of the most common late or chronic effects that we might see? And when do those typically appear for patients after their therapy concludes?
We can cause decreased lung function, and that's due to the scarring or fibrosis that can occur. That usually happens around, if it happens, 3 to 6 months after treatment. Radiation pneumonitis is another potential long-term side effect, and that's an inflammatory lung condition. That can happen around 6 weeks to 9 months after radiation. And in that case, steroids are usually prescribed to help reduce that inflammatory process. Cardiac toxicities can occur as well, but this risk is more cumulative over time, meaning that as time goes on and with age, those toxicities can increase. And another less common side effect, but can happen, is nerve damage to the brachial plexus nerve. And this would result in pain or muscle weakness, and that can occur months to even years after treatment is completed.
So, for any of the side effects that you've mentioned, are there any preventative interventions that we can recommend or maybe administer for radiation side effects that might occur during their radiation for lung cancer?
There's a few here. Good hygiene and skincare is important because the skin is getting irritated and inflamed. We want to try to prevent any skin infections such as cellulitis. So, patients should use good skincare, and that would include using a mild, unscented soap to shower or bathe, and then also using topical, non scented moisturizing creams or lotions. That moisturization can help prevent the redness, dryness, and irritation that I spoke before on the skin. And patients really should stop smoking, vaping, or drinking alcohol if they're partaking in these activities. Of course, good nutrition is always important and staying hydrated as well. And patients can also maximize lung function through pulmonary rehab and exercise. And I would say that providers can also help prevent side effects by reducing the dose to the heart and reducing the dose to the good lung tissue, if you will, as much as they possibly can. And this is done using intensity modulated techniques, or IMRT. And that's where the linear accelerator sculpts the radiation beams, conforming to the shape of the tumor itself.
So, when our patients may experience some of these side effects that you've mentioned associated with the radiation therapy, are there any specific tools or methods that nurses should be assessing for these symptoms? What do those tools look like?
I would say in our clinic, we just start with a basic exam of vital signs: blood pressure, heart rate, oxygen saturations, pain levels, those sort of things. If the blood pressure is low and the heart rate's high, they're probably dehydrated. And then, of course, checking their oxygen levels to make sure that they're perfusing well. So we just start with a basic exam of vital signs and then listening to the patient's lungs. We also need to listen to the patient themselves and determine if these symptoms are new, at their baseline, or progressing. And in our clinic, we see the patients weekly with the provider, but then also as needed, if patients need more frequent assessments, then we certainly can see them based on their symptoms.
And then, what would be some of the management strategies that you would recommend if they're experiencing radiation side effects specific to their cancer? And we already covered sort of the preventative ones. So, these would be more like a treatment for these side effects.
I would say that in the moment, the acute side effects that we talked about before, those would be more managed on a symptom focused basis, where the chronic side effects that we talked about would be more based on the side effect itself. And is it really affecting the patient? And if so, to what degree? And would we need to implement something at that point?
Finally, for all cancer diagnoses, we know that sexual health is sometimes under discussed and not openly brought up to patients. And so I think it's important that we always ask this question. So, for lung cancer specifically, how do you think sexual health can be affected by lung cancer and the radiation therapy they may have to receive? And how can we, as nurses or other healthcare professionals, help to address these sexual side effects?
I think overall, cancer treatment can lead to decreased libido and decreased sexual interest. Depression and fear can definitely play a role in this. And with lung radiation specifically, fatigue and possibly shortness of breath with the exertion may decrease sexual interest. Nurses and providers should support the patient in their desire or lack thereof in sexual activities. We should have open discussions, as you said, and these can take place with patients about intimacy and how that can be approached in a different way that can accommodate for the side effects that the patients might be experiencing. And we should encourage patients to have open communication with their partners about how they're feeling about themselves and their sexual health.
Well, Amy, thank you so much for joining us on the podcast today. As we get to the end of our discussion, we do like to always wrap things up with a few quick questions that help to summarize some of the great points that we've talked about. So, to start that off, how do you think healthcare professionals should evaluate maybe their hidden bias, any sort of implicit bias that they might hold just about radiation side effects in lung cancer?
I think it's important to remind ourselves that patients are not to blame for their diagnosis. Not all lung cancer is due to lifestyle and choices, and non smokers get lung cancer too. Some cancers are due to environmental factors. So, that said, if patients are still smoking or vaping, we do have a job to educate that radiation will not work as well if smoking continues, and the risk of reoccurrence is much higher.
What do you think are some common misconceptions about radiation side effects related to lung cancer treatment?
I think skin side effects are pretty minimal with the advancements of radiation technique and dosing. So we don't see the stereotypical burned skin as much, although there are always zebras out there that can react more significantly than the normal. And I would say radiation causes less lung function loss than surgery, especially with the IMRT technique, as I mentioned before. While surgery's been the standard treatment recommendation, SBRT has been shown in recent studies to be as effective. But of course, not everyone is a candidate for SBRT. The size, stage, and location of the cancer does matter in the technique that we can use.
What's something about this topic that's not often discussed, but you wish people knew more about?
Post radiation scans will be abnormal. Post radiation imaging can be misread as progression of disease or residual disease. And I tell patients, don't panic. Talk to your radiation oncologist so they can read the imaging themselves and interpret the results. Oftentimes, what's read as progression is radiation treatment sequela of scarring or fibrosis. And then another thing that's really underutilized is low-dose lung cancer screening. It's certainly not utilized to its fullest. Even if we're seeing a patient for a different diagnosis of cancer other than lung, but they qualify for low-dose lung cancer screening, they should be screened.
What additional training or education do you recommend for oncology nurses to stay current on this topic?
Well, nurses should stay up to date on the NCCN guidelines and know what new systemic targeted therapies are coming out, because patients can actually get tested at diagnosis for mutations or biomarkers that they might have, then move on to standard radiation treatment. Then, if they reoccur, they can go on targeted therapy afterwards without having to have more biopsies and waste potential valuable time, as the providers will already have this information.
And then finally, what are additional resources that you might recommend for patients or other healthcare professionals who want to learn more?
For patients, again, NCCN has a really good patient section as a resource, and websites like Longevity or Inspire have a peer support system where patients can go online and be paired with a support person. And for other healthcare professionals, I just think continuing education is critical. Again, NCCN, reputable websites, and seminars are ways for healthcare providers to get the most current treatment options and recommendations. There's so much research happening right now, so it's important to stay up to date on the latest trials that our patients may qualify for, because the learning never stops in this ever-evolving field.
Well, Amy, thank you so much for joining us today on the podcast. Again, I really appreciate your time, and I think it's great that we've had a chance to talk specifically about radiation side effects and how we see them appear for patients who are getting treatment for lung cancer. So thank you so much. Do you have any final comments to share with our listener today?
I don't. I just really appreciate the opportunity to come and talk about diagnosis and treatment that doesn't oftentimes get the spotlight. So thank you for putting this in front of folks to learn a little bit more about.
Wonderful. Thank you again.
Thank you.
Thank you for listening to the ONS podcast. Tell us about your favorite part in this episode by leaving a review wherever you download your podcast. For more resources and information about oncology nursing, visit us at ons.org and ons.org/voice. The ideas and opinions shared in this episode represent those of the guest and not necessarily ONS.